everybody. Welcome to our next edition of Corona Mama Conversations. Today, we are chatting with my good friend, Dr. Keri Holloway. How you doing?
I'm doing great. How are you?
Good, good. Thanks for joining us today.
Thank you so much for having me.
So everyone just remember, with these conversations, although we do have medical specialists on, we don't want you to take any of this information as official medical advice. You should always seek the advice of your medical professional. So Keri, why don't you just introduce yourself to our audience?
Yeah, so I'm Dr. Keri Holloway. I am originally from Louisville, Kentucky, and I lived in New York City during part of medical school and for my residency training. And I met my husband there in medical school, and we moved to Atlanta, Georgia about 3 years ago now.
And so Dr. Holloway is an OB-GYN here in the Atlanta area. And so definitely want to have a great conversation with her today. I know a lot of the Corona mamas out there are afraid, those who are expecting, those who are wanting to get pregnant, and those who are recently delivered. So let's just tell us a little bit about your practice.
So I'm in a large private practice in Atlanta, Georgia, and we are lucky to be situated throughout diverse amount of geographic locations in Atlanta. So all the way from Midtown to Cumming to Canton is where I practice, and most of my partners as well.
Okay. And tell us a little bit about, what life is like for you and your family right now during, coronavirus.
Yes. So day by day, right?
Right.
I think like every day to every week presents new challenges for my partner, Justin, and I. He is an emergency medicine physician, and I'm an OB-GYN. So we have to go to work, right? Like we have very limited scope of practice for telehealth. So we are constantly trying to switch gears and come up with ways to keep our family safe, to keep ourselves safe, and taking care of our little boy. He's going to be 2 in October.
Yeah. And so tell us a little bit about the beginning of, when shelter in place and things just kind of really got turned on its head, him being an emergency room physician, really being on the front lines of some of these things. How did you guys manage during that time?
So I think we felt like a lot of shock and apprehension. And because we trained in New York, both of us, he trained at Long Island Jewish and I trained at New York Presbyterian Methodist in Brooklyn. We have a lot of very close friends and colleagues and mentors who experienced this in advance of us. So I think it affected us both differently, but there are negatives and positives to that. So there was this kind of lull of apprehension, and then also all of a sudden knowing for sure about what we were about to experience together and what we were going to be going through, because we had all of our friends and colleagues on the other side in New York living it, and we were in constant communication with them during that time.
What were some of the key words of advice that they had for you, especially them being medical professionals, passing that information on to you as medical professionals and trying to navigate that space?
So we got a lot of practical knowledge, like what different hospitals and institutions were doing to manage the patients. But then emotionally for me, several of my colleagues and mentors, attendings, and people who trained me having this brief period of time where they were actually caring for women without their birthing partners was just very concerning. But it gave me a wake-up call, and a reality is that I might not just be an OB-GYN next week. I might also have to be a birthing partner, a doula.
Right.
Caretaker,
right.
Which I feel like a component of an OB-GYN is always makes up of that. But when you are with a woman and the possibility that they don't have any of their loved ones with them was just very scary to think about.
I mean, yeah, you think about that and it's just so traumatic for families and caregivers alike, just everybody's being stretched thin, everybody's emotionally in just a new place and a new space in the unknown. So definitely appreciate your hard work and, at least consulting with them in advance to understand as it moved down here, what life would be like, for us here in Atlanta. Um, so tell us a little bit about what the practice currently looks like. Actually, let me take a step back because I forgot to ask you during asking about what your current life, what does childcare look like for you right now with a 2-year-old?
Yeah, so right, it's always a challenge with a 2-year-old and a very busy toddler. And my son is just so athletic and outdoorsy and to be constantly busy. And just before COVID had hit here, we had enrolled him in a part-time Montessori program, and then the other part-time of the week he was with his nanny, who had been thankfully with us since he was about 8 weeks old.
Okay.
And we were very lucky to have a flexible nanny who was willing to pick up those extra hours. So we pulled him from the Montessori program, and then he has nanny care full time.
Okay. And that continues on currently?
It does, yeah. And in the beginning, she actually moved in with us for a couple of months. So, and she ate dinner with us every night. She was really, really involved in the daily activities of our son's life. And she not only became a nanny, but really a teacher, and just really started to focus on some of the things that he was doing in the Montessori program and bringing it into our home, which we couldn't be more thankful for.
Right. Yeah, I mean, and I know a lot of our Corona moms are currently, asking, what do you tell us how you navigated what requirements or conversations you had with your nanny? Obviously you can't completely control that person's life and their exposures, but how do you have those conversations about them protecting themselves? And also, I'm sure she was concerned, as you two are physicians, how does she protect herself from maybe you all?
Yes, especially with my husband's job in emergency medicine, and the fact that she lives with her two older parents.
Hmm.
I think that we initially posed more of a threat and a risk to her in her life, which she was very willing to come and move into our home to protect her family. So right from the get-go, we knew that we were all really on the same page with this. But they're difficult conversations, right? Like you
Hmm.
don't want to feel like you're controlling this person who works in your home, and you don't want to feel like you're suffocating them when they're taking care of your child all day. So just lots of open conversations and trust in each other.
Yeah, definitely. And I think that's one of the main things we've learned throughout this whole process. And one of the reasons I started Corona Mama Conversations, because there's no necessarily right or wrong answer. You have to figure out what is best for you and your family. And, it's about a conversation. So, kind of transitioning over, what type of things did your practice adopt? I know there was a lot of cancellation of elective procedures on my part and so many other people's parts. And then things have kind of, you know, for some people gotten back up to speed. Kind of right now in this snapshot in time, what does your practice look like?
So we had resumed all elective procedures, and luckily our preventive care components in the office as well, like mammography, annuals for pap smears,
Mhm.
um, and while continuing to provide obstetric care. But we really, due to the adequacy of PPE and our ability to space out patients and the times that we're scheduling them, we've really been able to create the safe space to provide care, whether you're an obstetric patient or a gynecologic patient. So we do universal masking for patients and all healthcare providers and staff. The time slots for the appointments are more spaced out, so we have more space in the waiting rooms. Unfortunately, that means also not being able to accommodate having a birth partner or a support person in the offices, which is such a bummer for all of us. Like but we encourage FaceTime, and so a lot of those first looks on ultrasound will do FaceTime and anatomy scans and things like that.
Yeah, yeah, definitely. Um, and so, what might be some advice you may give to a pregnant woman at this point to protect herself, other than the basic, social distancing, wear a mask? Are there any other particulars that they should be doing right now?
Yeah, so from a medical standpoint, I would just really encourage that you don't neglect the preventive care components of your health.
Hmm.
So, what that might look like is daily exercise and diet. seeing your dentist, especially if you're an obstetric patient. Don't let those dental visits get away from you. Also, keeping your pap smears and mammograms up to date during this time if you're not obstetric patient. Really just not neglecting that component of your health is really going to be important. The other thing is to have ongoing and open communication with your obstetrician. Always kind of asking for updates about hospital policies and protocols, finding out where the childbirth education classes are going to be held. All this can just help you be more prepared, and also is very effective at reducing anxiety.
Mhm. Yeah, definitely. And so, what about even for those not yet pregnant moms? What's some advice about, seeking to get pregnant during this time frame? Is there anything different?
So optimizing your health again, making sure all your preventive care is up to date. Also, pregnant or non-pregnant, I definitely recommend the influenza vaccine. That is going to be very important as we go into the fall of 2020. And speaking with your birth partner and your close family members as well. With the vaccination programs, really you have this idea of just cocooning you and your nuclear family against influenza vaccine if you're all vaccinated, Tdap, so pertussis and whooping cough, the MMR, all these things are going to be really important, especially once you have that neonate who's not old enough yet to get their own vaccines.
Yeah, yeah, definitely. Um, and is there anything for those who have just delivered, kind of going forward a little bit? You talked about some of the vaccines to protect that newborn who doesn't have a fully developed immune system yet, who's not really able to get a vaccine. Any other potential specific protocols that they should be adhering to at home?
So that's the very difficult question. And I don't think that there's like a one size fits all approach to this. As you briefly discussed before, each family is very, very different. And what's going to work for one person and family is not going to work for another. And I also really suggest that you find a pediatrician that is accessible, who can answer your questions and come up with a plan with the child's pediatrician about, who can come into the home, who really should wait, because there are some neonatal factors too, like preterm delivery. A baby who is delivered preterm is going to be very different than a full-term healthy baby. So to keep all those things in mind, and that's where I really recommend collaborating with your pediatrician.
Yeah, and definitely even with the local health departments, they are going to be instrumental in letting you all know, what your local rates of the virus are, transmission, any hot spots. So definitely want to utilize all those resources that you have available to you. What's labor and delivery looking like for you guys these days? I know you guys aren't banning any birthing partners currently, but what are the protocols surrounding labor and delivery?
So birthing partners, as you said, are still allowed. And where I practice, we never had to make that difficult decision. And I don't anticipate that we're going to have to, the way things are in this moment.
Good.
Women who are coming in for inductions or pre-scheduled C-sections are getting testing for coronavirus about 3 days prior to the planned date of delivery. Okay. And then women who are coming in active labor are getting a rapid test at this time.
Okay.
All partners and patients are encouraged and required to mask, and everybody's pre-screened at the door.
Okay. And so the partners are not getting tested, just the birthing mother?
Correct.
Okay. And during the time period of labor and delivery, are the birthing partners required to stay at the hospital the whole time? Are they allowed to come and go? I know, some people have other children at home that need to be looked after. How are you guys dealing with that?
Yeah, at this time they are allowed to come and go.
Okay.
They just need to be pre-screened upon each reentry.
Okay. With that also being said, for example, if there is a preterm delivery and the baby has to spend time in the NICU, what's the protocol surrounding that?
The NICU families, they're pre-screened. There was a period of time where they were not allowing visitation, but now that visitation is allowed.
Good.
And the families are checked for temperatures before going into the NICU.
Okay, good. Great. And I did want to transition just a little bit. I know in this time, things have been, very anxiety provoking, very stressful. Everybody's been at home. There's a lot of focus on the news about some of the disparities that have been brought out, not only in medicine in general, but, even more specifically focusing on birthing moms and African American women. And tell us a little bit about your perspective or experience with kind of maternal mortality, especially when it relates to African Americans, since it is documented that they're about 3 to 4 times more likely to experience mortality or a bad outcome.
Okay, so first, I just want to say that we have a lot of work to do. Maternal morbidity and mortality, it affects Black women at a much higher rate than other races, but not only maternal morbidity mortality, but also neonatal and fetal maternal morbidity mortality, preterm labor, preeclampsia, eclampsia. Black women are less likely to initiate breastfeeding, and as the child's age advances, they're even more less likely to continue breastfeeding. Also, infertility affects Black women at a disproportionate rate, as well as access to fertility care. We also have increased risk of comorbidities and even breast cancer in this population. And so I think really what we absolutely have to focus on is bridging this gap of access to not only care, but it has to be quality care.
Yeah.
And that really we need to be focusing on. Just going through the list with you just now, you can see how OB-GYNs are uniquely situated to make an impact in this. And my practice in particular, we have a very important role for our community. We practice obstetrics, but also gynecology. The majority of our obstetric practice is very high risk. So we're very comfortable managing these high-risk populations with diabetes, high blood pressure, and other previously mentioned risk factors. And we work very, very close with an outstanding group of maternal fetal medicine specialists. So one thing that we do offer the community is that we accept Medicaid and Medicare insurance. We also take walk-in call. So we either will care for gynecologic patients from the ER who are unassigned, or obstetric patients that come in, and the majority of these patients don't have access to a primary care physician or prenatal care. So that way we can see them, we can give them that quality care, and then we follow up with them in our office where we can reiterate and go over a plan for them, and we can provide them ongoing care. And then most of the partners in my practice are in leadership positions. So they're on GYN committees. My senior partner is chairwoman of the department. A lot of our senior members are also on statewide OB-GYN boards. And so through this way, we do get to have direct access to this data. This data is so important to collect and to analyze. And a lot of us are very involved in like policy making and quality analysis.
Yeah. A lot of this, just really came to my attention with my just, giving birth a little over 6 months ago. And, I tell my story. I experienced postpartum preeclampsia. The night before I was supposed to go home, they came and checked my blood pressure. It was through the roof. And, I'm there for a few more days on drips. Never had an issue with blood pressure in my life, and then I go home. I'm on blood pressure medicines at home for about 6 to 8 weeks afterwards. And, going through that process made me dig a little bit deeper. And I see these numbers, and that number of the 3 to 4 times more likely for African Americans to, experience a mortality. That's regardless of their socioeconomic status. So, me being a doctor has nothing to do, my knowledge has nothing to do or nothing to help prevent that from happening to me. And so with a lot of everything currently going on, and I definitely respect and appreciate, all the work you all do and how your practice is so involved with policy and policy changes. Have you guys implemented anything in particular during this time frame of just kind of a little bit more enlightenment or things becoming more to the forefront right now? Anything in particular that you can say is different?
Well, we definitely have acknowledged it, not only amongst each other, but also with our staff. And so, and we know it good quality care starts there. So we've tried to facilitate the conversation. We have a liaison that staff and healthcare providers can go to discuss these disparities and what's happening in this social climate. And then also we have an anonymous pathway. If they didn't feel comfortable, we have boxes at each of our office just to try to keep the flow of communication going. But like I said, we still have a lot of work to do.
Yeah, I think it's very important, just like you said, the first line of defense or care in your office is going to be that person that answers the telephone. And so if they're not aware of, the gravity of certain situations, they need to be aware of, even small things might not be so small. And so to really let them know. And so I think that's important too. You guys may be all doing all the work behind the scenes that you need to do as physicians, but it's that front line that really has that first chance of making a difference. So we appreciate that. Keri, tell us, right now during this time, are pregnant moms being disproportionately affected by coronavirus? What are their unique risks?
Yeah, so in general, we know that any viral illness is going to disproportionately affect a pregnant woman in the way that they're going to be at increased risk of getting a viral infection, but also at an increased risk of having a severe manifestation of it. And that has to do with the basic physiology of pregnancy. The pregnancy-related hormones are going to increase the risk by affecting the airways. And then after 20 weeks, the gravid uterus is going to start to impose effects on the diaphragm, which is the major muscle of respiration. So we know in that those two ways that viral illnesses like influenza affect pregnant women differently. Now with coronavirus, this is a very new disease, so we're still constantly seeing new data on it, and it does not appear that it's going to particularly increase the risk of transmission. Now, like I said, it's still in its infancy, but we do see some preliminary data that suggests that the severity of illness is increased. Not necessarily the mortality though, but the risk of having mechanical ventilation required is increased, and then also long ICU stays. But again, we just don't know these long-term effects.
Sure. And what about transmission to the unborn child, or transmission? Is there risk of transmission during delivery?
So there are several very well documented cases of vertical transmission in the literature, but they're few, which suggests that vertical transmission is very rare.
Okay. And is there any indication that mom needs to be separated from a newborn currently if she is positive?
So right now, there doesn't appear to be. I think that's backed by the CDC and the World Health Organization. And recently at the institution where I practice, that separation is no longer a requirement, but it should be always informed consent and a risk sharing between the pediatrician, the mom, and the obstetrician and gynecologist.
Okay.
But there's so many benefits of allowing that rooming in and that bonding. So there may be some slight modifications that we can do as healthcare providers to facilitate the safety of that.
Okay, well, great. So we're just about out of time. Is there anything else that you wanted to talk about or add, or tell us about the name of your practice? Give us the website, any information.
Yeah, so I'm with Peachtree Women's Clinic in Atlanta, Georgia.
Great. So thanks so much to Dr. Keri Holloway for joining us on today. We had a great conversation. Again, just remember that nothing we said today is official medical advice. It is always pertinent that you discuss with your medical professional what you should be doing and what is best for you and your family. Thanks so much. Follow us on Twitter at CoronaMama1, and you can go to our website, coronamamas.com. That's corona-mamas.com. Thanks again, Keri.
Thank you.